In other news from around the world, the U.S. under President Donald Trump has paused funding for the President's Emergency Plan for AIDS Relief, PEPFAR, raising concerns for global HIV/AIDS efforts. Now, since 2003, PEPFAR has contributed over $85 billion to combat the disease, saving millions of lives in more than 50 countries, including Nigeria, which received over $6 billion. However, recent funding cuts have sparked fears about Nigeria's ability to sustain its progress. A source at the Institute of Human Virology, Nigeria, pointed out that the Nigerian government has not fully taken over HIV and malaria programs, leading to reduced American assistance, and this funding freeze, which affects both new and ongoing initiatives, threatens the health of over 1 million Nigerians who rely on PEPFAR for life-saving treatment. Experts warn that the situation could worsen without renewed support. Now, to discuss this, we're joined by a public affairs analyst, Theophilus Akatugba. Thank you for joining us on the news, Theophilus.
Yeah, good morning to you. Pleasure to be here.
It's a pleasure. Now, can you speak to us on the wide-reaching or the long-term consequences of PEPFAR funding pause for Nigeria's HIV/AIDS response?
Well, the first, there will be, reduction in access to HIV treatment, which is being funded by this program. It's going to increase HIV, transmission, because all supports that help to, increase and awareness and education will disappear. It will also strain the healthcare sector in no small way, because you don't have funding and the people will keep coming in. The truth is that until you really have someone who is in this bracket of health need, you will not know the impact of some of this free treatment and free support that the PEPFAR provides. Can you believe it? That such huge amount of money comes into the country to support this, health needs of people who are in need of this particular, requirement. And you see that it affects the population. It will affect the population in a very, big way. And it's so sudden that the health care and those who benefit from this are caught napping. And I feel very, very, that it's going to have very far-reaching consequences.
All right, now, speaking of, its effect when it comes to access to treatment, prevention, and also care services for people living with HIV, are there steps that you would suggest the government takes to ensure the sustainability of HIV/AIDS programs?
Yes, the government, this is an emergency for all of those who are in that sector. The government must step in now with alternative funding mechanism so that those who are on this program, who are beneficiaries, systems and institutions that are supported, including all the research institutions and the researches that are going on, should be sustained. This would place an economic strain on the government, but it's something that needs to be done so that we don't have we don't suffer the consequences of the withdrawal of this funding. But the good news is for 90 days, and that after 90 days, this will be reviewed. Now, the reason this is stopped is to be sure that this fund is being utilized for its purpose, because they have received some reports that some people have diverted the fund to fund abortion and the promotion of abortion.
Well, 90 days, equivalent to 3 months. Do you think that, the funding cuts in that time could lead to a resurgence of HIV/AIDS in Nigeria and other countries that rely on PEPFAR for support?
Yes, it's a possibility, because once you are not creating the required awareness, you are not funding all the free distribution of condoms, and you are not funding antiretroviral that are given to ensure that the infection does not, progress. This will lead to a breakdown of that system and is likely to increase the spread because those who are not curtailing themselves, who are not taking medications, will unleash themselves on society, and that is a big possibility.
All right, well, thank you so much, Theophilus, for speaking to us.
Thank you very much. It's a pleasure to be here.